Omicron has become the dominant strain here in Korea, and there are growing calls for a prompt transition into an Omicron-tailored response posture. For more, I have Professor David Kwak from Suncheon University. Professor Kwak, welcome back.
Good afternoon.
I also have Professor Lee Hoon Sang from Yonsei University. It's been a while, Professor. Welcome back.
Oh, thank you for having me today.
Right, Professor Kwak, in a matter of slightly more than 50 days since its first detection here in the local front, Omicron has become the dominant strain. What are your thoughts on the speed of its spread here in the local front?
Well, it obviously shows the great speed at which the Omicron is transmitting. But I also feel that the reason why we see a quicker than expected rise in the numbers is probably because we probably had Omicron cases before its detection. So as I've said numerous times, I do believe that the number might have grown domestically without being detected from the officials. So it is rising much quicker. But I also think that we're not clearly in the zone to see a huge spike yet, because these numbers are set to double about in 2 to 3 days. We're hitting about 50-something% today. So in about 2 to 3 days, maybe then is when we're going to see a huge spike in the numbers. So we should probably brace ourselves for that.
Right, and talking about a huge spike in cases, Professor Lee, some are predicting that after next year's Lunar New Year holiday, Korea's daily tally will hit as high as 50,000. What are your thoughts on this, and what are your thoughts also on perhaps when Omicron will peak here on the local front?
Actually, also in Japan, after some holiday season period, they have experienced a spike, which has gone up quite high, much more than Korea right now. So I think after this Lunar New Year season, where many of the people will be traveling and there will be many of people's gathering, so we probably will be experiencing some spike. But when the peak will be coming, I think it will depend on how fast the daily number increase happens. So if it happens very quickly, like many other countries, such as South Africa and other countries, maybe within a month, maybe we will see the peak. But if the increase comes somewhat slowly, then maybe the time of the peak might comes a little bit later than that.
Right, I see. Well, over in England, health authorities there believe the worst of the Omicron wave is over, and a host of prevention guidelines are looking to be eased in the days ahead. For more on the situation there, I have David Cox live on the line. David, it's good to have you back on.
Thank you, Sunny. It's good to be on the show.
Right, so I hear Omicron cases there are on a decline. Tell us more.
Yes, so Omicron cases are down definitely compared to the start of January, which is great. So we've now got around 80,000 a day compared to 200,000 a day right at the start of January. So a big drop. And the real key is that fatalities and hospitalization admissions are also considerably down too. But as we know, Sunny, there is always uncertainty in this pandemic, as you don't know quite what's coming next. So there is also a new variant, which some people have dubbed stealth Omicron, which is thought to be even more infectious. And in the past few days, there's been lots of a number of cases of this, and some people are a little bit concerned because in Denmark this has already overtaken Omicron to become the dominant variant. So scientists in the UK are monitoring that one at the moment.
Right, I see. And meanwhile, David, how is the medical arena there explaining the drop in Omicron infections, and what is its response to talk about the pandemic becoming endemic?
Well, so this is the thing. So scientists do think that Omicron is milder than Delta, but also the big reason why we're seeing this drop in cases is simply just because of the effects of vaccines. So many people already have immunity to the virus. So Omicron in many ways seems to be similar to the original strain of COVID, which emerged 2 years ago. But just because of the vaccines, the antivirals, everything we have to fight it, it's not proving as deadly as the first strain did. But a lot of people do now believe that COVID is now endemic, so it's here to stay. But at the same time, that does not mean that COVID is benign. We will probably still continue to see more variants emerge, which could cause outbreaks from time to time. So we need vaccines to go to more parts of the world, and we need to actually invest in vaccines which protect against a broader range of variants really going forwards.
Right, an important fact right there. Professor Kwak, what are your thoughts meanwhile about COVID-19 moving toward an endemic state?
Well, I think Mr. Cox made a very good point of view here when he said that there's a certain uncertainty about the whole COVID-19 situation. The thing about Omicron that we are sort of feeling excited about is the fact that it's so transmissible. Excuse me. It's so transmissible that once it sweeps through the nation and the whole globe, for that matter, it's going to create a global immunity against SARS-CoV-2 as a whole. But there's also the chance that, because we are not currently certain of how lingering or how long the immunity we would receive from Omicron will last, because we have experienced it very shortly so far. And as Mr. Cox already mentioned, if variants were to occur, we are not entirely certain how much of an immunity this Omicron could provide us against a newly appearing variant. Obviously, I'm staying hopeful that it'll be long enough that once and for all, it'll reduce the numbers of further transmission. But in my personal view, looking forward, I think vaccines and treatment regimens still needs to be researched and implemented quite heavily, because there are also proofs that vaccinations given either prior or after natural immunity, meaning infection, would create 40 times stronger immunity. So if we go through Omicron as the whole nation and even be vaccinated afterwards, I think it'll create a strong, almost superhuman power of immunity that we will be kind of worry-free for quite a long time to come afterwards. But at this state, there are still uncertainties remaining even with the Omicron variant, so we should be careful not to completely loosen ourselves because of the less of the severity that we're seeing from the Omicron.
Right. But despite the uncertainties, David, come Thursday, face mask and vaccine pass requirements will be lifted in England, and come February 11th, as my colleague Soa mentioned, the COVID-19 testing requirement for fully vaccinated travellers to England will also be lifted. What is the public response to this?
I mean, I think the majority of the public are keen to get back to normal, as I think all of us are right now. There is still some resistance in some parts of the population to the rules being relaxed, but I think this is mainly from doctors and nurses unions who are concerned about the impact of relaxing restrictions on healthcare systems, and also from charities supporting vulnerable groups of the population. But I think the majority of the people are just very happy to try and hopefully get back to some more of a normal life in the coming months again.
Right. David, some pundits claim the planned ease in COVID-19 restrictions comes in response to public outcry over a number of alleged social gatherings that involve Prime Minister Boris Johnson during the UK's pandemic-related lockdowns. Is there any truth to these claims?
I mean, the story of the Downing Street parties has been the major news story in the UK in the past month. I mean, it's actually probably overtaken Omicron as the dominant news story right here. I mean, so at the moment, as things stand, Boris has signalled his intention to scrap all of the COVID laws by the spring. And politically, the government is banking really heavily on this summer being the most normal summer since 2019, and that helping to change the public mood, because there's a lot of animosity in the UK against the government at the moment. There's not only the crisis over the parties, but also the cost of living is rising very sharply due to inflation right now in the UK. So in reality, the Prime Minister had very little choice to do this, because all of his cabinet, a lot of his MPs have made it very clear they would oppose more restrictions. And with Mr Johnson's leadership on the ropes, it's unlikely he will be able to reintroduce any measures against COVID in the future, even if he wanted to. So it's basically more his own party taking a hardline approach on this to try and gain back political ground, really, in the coming months.
I see. All right, David, as always, thank you very much for making the time to join us live at this very early hour at your end.
Thank you.
Right, Professor Lee, back here in Korea, authorities initially spoke about transitioning to an Omicron response strategy if daily infections exceed 7,000. Now, they're speaking about a transition if daily infections exceed 7,000 on average. How do you respond to this shift in stance?
So I think the government was trying to be very careful and to come up with a figure that which will activate their response. But 7,000 is somewhat of an arbitrary figure. It is not a set number. And actually, we need a little bit of time to transit to another phase of the response. But But still, there are some of the concern that maybe the government, it would have been great if the government have transited much earlier than current phase. But it just takes time and resource, and a lot of guideline has to be given to local clinic, which later in the another phase of different in the different phase of the of COVID-19 response, the local clinic and hospital should be involved in the response, and then also there should be only the severe case will be tested for the RT-PCR testing. But there should be many of the changes that will happen, and readiness will getting things ready will take time. So that's why the government is not putting a strict number of 7,000, but they are now saying on average of 7,000 per day.
Right. And Professor Kwok, what are your thoughts on the timing of this transition into an Omicron-tailored containment strategy?
Well, so I'm hearing that some are worried that it might be too late to transition into this phase, but I disagree with that idea because I generally agree with what government is currently saying, that the transition we're about to make is to rather loosen up the medical sector's burden, and also loosen up the restrictions that we used to have on this virus alone, so that to only focus on people who are more vulnerable to having the disease more severely. I do agree with that specific idea because Omicron, at the same time it is being transmitted and it is being infected, is currently known to cause about half to about a fifth of the severity of what the Delta could have caused. So it's both a danger as well as a chance for this, really, the nation to gain immunity against SARS-CoV-2 much more at this almost simultaneously, as opposed to having to pick each group of people to be vaccinated and to go through certain phases to receive that sort of immunity. So it's both the chance and the danger we're facing at the same time. In that regard, the government's stance or tactic to really attack this rather more loosely, but focusing heavily on those who are more vulnerable, I completely agree. And for the matter of whether it being too late, I don't think there will be such an issue, because the later it is implemented, it only means that we're being more conservative and more careful. So if we go into this mode more later, it only means that we'll be more focusing very specifically and efficiently on the people who needs the care, as opposed to really generalizing and caring for everybody.
Right. So under this new strategy, Professor E, rapid antigen tests will be actively adopted. And as you mentioned, neighborhood clinics, that is, will offer treatment to those who are being treated at home, offer advice, supervise, etc. What are your thoughts on the efficiency of these measures and what needs to be done to improve them?
So it is just not possible to test everybody once there are 40 or 50,000 cases per day. So it is important, it is actually necessary to transit into this phase of providing testing for more of the severe cases, but reserve and have the supplementary the simplified testings for less severe cases. But I think the rapid antigen testing is one thing that we should remember is it is kind of a supplementary testing. It is not like finalized confirmed testing. I mean, the specificity and sensitivity is not enough. So even after this testing, the symptoms should be monitored carefully, and then we should just keep in mind the limitation of the testing capacity as well.
Right, and I direct the same question to you, Professor Kwok. What are your words of advice with regard to these new response measures to Omicron?
Well, I personally feel that we could probably focus more heavily on symptom-based approach to this. So instead of focusing, as I said, only to the people who would be more vulnerable, maybe we could also make a point to really treating or preventing people who are showing up with symptoms. Number two, I also think that there should be an attention made to younger generations currently rising up in their proportion proportion of daily confirmations. As we have seen from foreign countries all around the world, there, with the Omicron variants and also with Delta variant, actually, those who are not vaccinated or those who are vaccinated less than other generations seem to show up highly in the proportion of the Omicron variant composition. Not only that, there was also a rise in admission of those generations. So we should be very observant, but we should also come up with a better plan to further increase the rate of vaccination among these younger generations, plus the vaccination for booster shots given to the elderly generations and those who will be more vulnerable to the disease.
Right. Professor, Pfizer's Paxlovid, its oral COVID-19 pill, is being prescribed to those aged 60 and above here in the country. Now, there are calls for this age requirement to be further expanded. What are your thoughts?
So the government has actually expanded and lowered the age requirement to the 60s. So basically expanding the possible beneficiary of these treatments. And I think maybe there should be a further consideration to widen the age group because compared to the original previous phase of the COVID-19 outbreak that we have seen in the early period of global COVID-19 pandemic, especially with the emergence of the Delta variants and with these Omicron variants, we are seeing that there are some of the people who are younger than 60-year-old who are also developing severe symptoms for those people who are in their 50s or 40s as well. So, and also we are seeing some of the cases in people developing severe symptoms in the lesser number, but in their 30s or younger as well. So I thought the difficult thing is the medicine has been just recently available in Korea, and then we have a limited amount of the pills. So it is we have to be really we have to have a balanced approach. But I think we have to quickly think about the possibility of widening the beneficiary groups.
Right. And Professor Kwok, my final question to you. What are your words of advice with regard to prevention efforts as we look ahead to the Lunar New Year?
Well, let's remember, even though Omicron is rising, we still have Delta going around. So for those people who are not completely vaccinated, they should do so currently. But also those people who haven't been vaccinated still plan to meet their families for the Lunar New Year. They should be extra careful, keep the very strictest social distancing guideline, but Happy New Year.
Right. Professor Kwok, as always, thank you very much for your thoughts. Professor Lee, thank you for being with us today.
Thank you for having me.